Hey! Right, just give your head a bit of support.
Thanks, love.
Okay. So you got the buttons. Anything else?
No, thanks.
I can cancel.
Go, before I throw you out.
I bet you would too. I won't be long.
Brian.
What? What's wrong?
TV.
Oh, Brian.
Now, today is the video part of your RCGP accreditation, where, with your patient's permission, we will film your consultations. The purpose being that you encourage them to engage with and contribute to their own diagnosis and treatment, and then you tell them what's wrong with them and how to fix it. Oh, joy!
Is there really no way out of this?
No!
Why can't we just give them the tape I did last time? They'll never know.
If you got it right the first time, we wouldn't have to do it again, would we? Anyway, touchy-feely medicine and technology. Very 21st century.
Does work.
This thing is prehistoric.
Do you know what you're doing?
Every fool has one. I think I can master it.
Just make sure he switches it on.
Oh, ye of little faith. Ooh, cigar to the chap who invented these things.
Or a bucket of cold water.
I think I'll borrow it for the weekend.
Yes, then you'll have all the time in the world to play with it. Because you'll be on your own.
Boys and their toys. Haven't you got any patience to see Dr. Carter?
Wouldn't do to make a silly mistake.
Ready?
Yep, turn it on. And lights, camera, and action. Leave you to it.
Right, so, Mr. McQuillan, Brian, what seems to be the problem?
The last few days, I've had this pain in my jaw. I feel embarrassed being here.
Oh. Well, perhaps you could tell us about the pain.
It's a dull ache. It's been there pretty much all the time.
Okay, can you close your jaw? Well, what do you think that the problem could be?
Probably nothing. Age?
Do you smoke?
No.
Exercise?
My wife has secondary progressive MS. She's entirely dependent on me. I get plenty of exercise. And I used to run all the time.
Okay, there are lots of options. It could be a dental problem, TMJ dysfunction.
Shouldn't there be a light on?
Worst case scenario, the pain could be caused by some forms of cancer or heart disease, but you haven't...
Cancer?
As a healthy non-smoker, it is highly unlikely, but we can carry out further investigations.
Do you mean go to hospital? I don't want that. Helen needs me at home.
Okay, well, we could try some painkillers for now, and then if you keep an eye on the pain in your jaw for a week or two, if it's still a problem, then we can take it further.
Perfect. Great.
So how was it?
Actually, it went really well. You did put the tape in, didn't you, Heston?
Of course. Do you think I'm an imbecile? Oh.
Heston.
Maybe next time
I'm home.
How was it?
It's nothing. She gave me painkillers.
You told her the pain kept you awake all night.
Of course.
And they're starting to put a little bit of pressure on that they want to move in.
I'll do it.
We really feel we need to move.
So the pressure's on you and now you're passing it on to us, basically. Thank you very much. Specific details then.
If you had your head cut off, you'd still say it was just a shaving, Nick.
Rubbish.
Council phoned. There's a message. It's another offer of help.
We don't need help.
You could go back to work.
That last care worker was hopeless. You didn't like her.
It wasn't that. I hadn't got used to this. I took it out on her.
No. I am not leaving you with a complete stranger again.
The receptionist said you told her it was a bit embarrassing and delicate, but you've got a rash, right? On your penis. Are you sexually active? I mean, with someone else? Would you like to tell me about the rash? Dean. Would you like me to turn the camera off?
Morning, George free?
Sorry, she's with a patient.
I have to get back to work. I picked these up for her. Could you make sure she gets them? Required lunchtime reading. Tell her there'll be a written exam.
Discovering Shanghai and China for idiots. I must say, I think it's incredibly brave what you're doing. Emigrating.
Yeah, it's exciting.
I sometimes wish I'd had the courage. When did you know that it was the right thing to do?
I don't.
Oh.
I won't know for sure until we're out, settled and happy. I have my doubts sometimes, but the chance comes up, you have to take it, haven't you? We regret the things we don't do more than the things we do, right?
Absolutely.
Bye, Dean.
And?
No.
Are the pills ready yet?
Just coming.
And don't let the bath run over.
I won't.
Can I have fries with that?
Ketchup?
Please. There's a brush in the hall. You can multitask.
Jokes? You feeling better?
I just lose patience. I mean, like coming here, I'm at a junction and this fellow's in front of me. And the lights went amber and there's nobody crossing. Yeah? And he's waiting for the lights to go bloody green. And I'm shouting at him, go! Go, go, go! And then he stalls and I'm like... It's like my blood is boiling all the time. You know? It takes nothing and I'm...
Okay, so the first thing we're going to do is take a deep breath. It's to calm you. It really helps, believe me. Okay? And then we're going to relax our hands, stretch out our arms. Come on, it'll help. Okay? And take a big breath. It's better. You breathe out too.
It's like, I'm worried that it's up here, you know, like I'm depressed or something.
Do you feel depressed?
That's what I just said.
Right, no, but I mean, when you're not angry, do you feel depressed?
Oh, I suppose not, no.
Okay. Okay, so let's put the depression to one side for now. What do you think might be causing the problem?
You're the doctor. You're supposed to tell me what's wrong, yeah?
Yeah, but
That's what you get paid for.
you know your symptoms better than I do.
Do you know what's wrong with me or not?
But it's really not that simple, especially because, you know, we're talking about your mental health.
What, so I'm a nutter?
No, absolutely not. No. Our approach to mental health is far more sophisticated.
Oh, don't be ridiculous.
I'm going to go out on a limb here, Kenny, and suggest that you might have a problem with anger management.
I am just stressed. I'm not a basket case.
No, and you shouldn't worry because there's so much we can do to help.
I do not have a problem with anger management.
Kenny?
No! 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 No!
Oh.
Please, please, Lionel, don't. It's Lionel.
So why is he calling you?
Because I called him, I hung up.
Well, why won't you answer it?
Because
what?
because I'm scared.
Sweetie, if you really didn't want to talk to him, you would have killed that call by now.
Coffee. Can't we get one of those machines that makes quadruple espressos?
No, we can't.
How are the sessions going?
Let's see. Well, there was one session this morning that went really well, where the patient was trying to engage with what I was trying to do. You know, the one where you forgot to put the tape in.
Sorry about that.
Yeah, and the rest have been disasters. I'm going to fail my accreditation, I'm not going to pass, and it's all going to be your fault.
It's unfortunate, but you must make it work. It's really not so difficult.
I know. But I really must get back to work.
He's just going to keep calling you, Vivian. Look, talk to him. I'll get Karen to cover for you.
Oh, just answer the thing, will you?
Lionel?
Well, I'd hide for the rest of the day if I were you.
How are you? Viv, are you there?
Yes. Yes.
I suppose you've heard I'm back in Leatherbridge?
No. Yes.
Yes. I suppose Heston told you. He never was one to keep in confidence.
How's life in Bermuda?
Yeah, it's wonderful, yeah. I wear shorts all the time. No, there's little I miss about England. Certainly not the cold, nor the warm beer. Nor the ongoing tragedy of our cricket team. Look, I'd really like to see you for dinner tonight.
I don't know.
Well, it's got to be better than talking on the phone, surely. Viv, are you still there?
Yes, let's meet for dinner. I finish at about 6. Oh, and Lionel, no shorts.
Absolutely no shorts, I promise. Yeah.
So then he asked me if I think that he's an imbecile, and I'm like, Heston, is that a multiple choice?
So
he's put me through hell today. I had to...
Whoa, Melanie, put the teapot down, otherwise you'll start World War III.
Well, is it any wonder? I mean, I'm so worried about Heston and about the camera, and I'm paranoid that I've missed something.
Okay, like what?
Well, if I knew that, then I wouldn't have missed it, would I?
Would it help if I came and looked at the tapes with you? Okay, but first we need to put the teapot down on the side, not the floor. There we go. Deep breaths. Hands out. Okay, let's go.
Okay.
The good news is you've definitely lost weight.
I knew there was an upside to MS.
Oh, hang on.
What?
Break.
Don't be such a drama queen, Brian. Brian, what's wrong?
It's nothing.
Forget the bath. Sit down, take it easy.
I'll be fine. The doctor said I was in good shape.
Would you like me to switch the camera off?
It's not funny.
No, it's not funny. I'm sorry. All right, you've not missed anything so far. How many more are there?
3. Plus one more consultation where Heston screwed up the tape.
Okay, well, talk me through it. Oh, not funny, not laughing.
Okay, so this fella came in with pains in his jaw, so I went through the usual suspects.
Brian, put me down.
Dental, trauma, cancer.
Lifestyle.
Yet there was nothing to suggest that he had arthritis or angina.
Brilliant, you got everything covered.
Angina.
Brian.
I remember thinking to myself,
Brian.
ask him about angina, and then he noticed that the red light wasn't on the camera.
Call him. Call him.
Brian.
Not answering. Not answering.
Hi, this is Brian and Helen's. We can't get to the phone now, but you know the drill.
Hello, it's Dr. Bell from the Mill Health Centre. I wondered if you would be able to give me a call at the surgery on 012.
It's no good.
496.
Sorry, Brian.
0606.
Can you hear me?
Thanks.
Off me!
Brian.
Sorry, I know I shouldn't. No willpower can't die to save me life.
How overweight are you, anyway?
You're a cheeky one, aren't you?
Come with me, my dear. You could help us out with a little problem.
Hi, this is Brian and Helen's. We can't get to the phone now, but you know the drill.
I believe I found a solution to our problem. The lovely temp who's with us has some personal issues around her weight. I think she'd be ideal to help.
Dr. Carter, you can't drag her away from her job.
It's not a problem.
Having you more important things to worry about.
Pardon?
Vivian, could you get me Brian McQuellan's mobile phone number, please? She's staff. Isn't that cheating?
Well, if you want to be pedantic, I suppose. She's not really staff. She does have a genuine problem, so what's the harm? Let's get this out of the way and you can get on with your job.
So where do you want me? I've got 2 kids, teenagers. My son's never in and my daughter's never out of her room. It's exams, I hope. My husband, Rob, he's away with work a lot at the moment, and even when he's back at the weekends, he's knackered from travelling and talking with his mates about that Martin O'Neill and what he's doing with the villa.
How do you feel about your weight?
Well, you can have too much of a good thing, can't you?
And what about your husband?
Oh, he's got no complaints. He likes something to grab hold of, do you know what I mean? But see, I get lonely nights, and nothing much to do, really, except watch the telly and eat.
Comfort?
Yeah. Yeah, the crisps don't ask questions, do they? See, I was thinking about one of them gastric band things, you know, like her off the telly ad.
Yeah, well, a gastric band would be an option, but you know, it's really a last resort. And, I mean, to be honest, Karen, you don't look to me as if you're carrying a lot of weight.
Oh, thank you.
But certainly not enough to justify an invasive procedure.
If everything else fails, we could amputate my hands. That'd stop me eating all right.
Or you could join a gym. I mean, exercise is a brilliant way of losing weight, and certainly less painful than amputation.
See, I hadn't thought of that.
Splendid.
Brian McWellan's mobile phone number.
Thank you.
Have a lovely evening.
You know, I think Karen's got some serious problems. She needs counselling.
Really? Yeah, don't worry. I'll have a word. excuse me, my dear. Thank you so much for helping us out.
My pleasure.
You were exaggerating, weren't you?
Yeah.
Right.
Help. Someone's at the door. Shout.
Help! Help us, please!
Brian? Brian? Police and ambulance. Yeah, hi, this is Dr. Melody Bell. I'm at 19 Kerrydale Street. Something's happened to one of my patients. Yeah, this is an emergency, yeah.
Weak. What's wrong with him?
I think that when he came in with the jaw pains, I think he had angina. He's probably had a heart attack, which is sport on heart failure.
No. Take Helen. Take Helen.
I'll wait with her until the other ambulance comes.
Well, she needs,
She needs you to be well. Think what happened to her if you weren't around. Try and put yourself first for once, okay? Take the time you need.
Thanks. Thank you.
Don't thank me. Heston, it's Melody. Look, about that tape with Karen, you were right. It's just a hoop to jump through. It's got nothing to do with being a doctor.
This is a lovely place. Good choice.
Well, these things certainly taste good when you're sitting by the Caribbean.
So, life's good out there.
Yeah. Yeah, the only thing that spoils it is having to deal with rich Americans who can't even pronounce Caribbean properly. Dad, I'm missing you.
So you're well?
Oh yeah, absolutely. You?
Me? Yes. Yes.
I meant what I said about missing you, you know.
Please, Lionel, don't.
But you're beating men off with a stick.
No.
I'm sorry, I didn't mean to say anything.
No, it's all right.
Yeah, you're right, I should never have.
You don't know.
Know what? Why, what's happened? Viv, wait! I don't know what you...
Please.
No, not until you tell me what happened. I'm sorry.
I was attacked.
What? When?
I was assaulted. Please, don't make me say it.
I had absolutely no idea.
I just thought Dr. Carter would have said something.
No, even Heston knows when to keep his mouth shut. Oh, I should have been here to stop.
Oh, don't be ridiculous.
Viv, in a couple of days I'm going back to Bermuda. Come with me. Let me look after you, protect you.
My job.
Oh, stuff your job. If it's work you're after, I can find you work. That bit's easy. All you have to do is just say yes.
Don't let me go.
Hey! What part of be quiet do you lot not understand?
Oh, I can smell it. Don't listen to Lady Muck's poisonous rubbish about this baby's paternatality.
I'm really upset, actually, Michelle, that you would use it to make fun.
I'm sorry, Ruth.
I'll drop round this evening, Viv. By that time, hopefully you'll have realised just how much rubbish you're spouting.
Pauline Quirke's professional and personal lives collide in the story continuing to unfold in our week-long series Missing next. And later, as part of Tuesday night drama lineup, more troubles in the love lives of the mistresses at 9 here on BBC1 Scotland.